Good morning. I'm Deanna Cox. I'm a nurse practitioner, and it's nice to meet you. I'm going to be doing a head to toe on you today.
Great.
Are you in any pain or discomfort?
No.
Wonderful. Patients without pain. I'm going to wash my hands. And the first thing I'm going to do, and I hope my hands aren't too cold, they get a little chilly. But the first thing I'm going to do is ask you some general questions.
Okay.
First of all, do you know, can you tell me your name and date of birth?
Sally Smith, 1/1/1960.
Very good. Can you tell me the day of the week?
It's Friday.
Thank you. How about the year?
It's 2023.
Okay, and do you know why you're here today?
I'm here for you to perform a health assessment.
Okay, and do you know where you are?
I'm at the College of Nursing.
Patients alert and orientated ×4. The next thing I noticed, she's dressed appropriately. Her affect is appropriate. Her speech is clear. There's no obvious distress. The next thing I'm going to do is ask you, do you wear contacts or glasses?
No.
Okay, what about any hearing aids?
No.
Great, thank you. Now I'm going to assess your pupils. I'm going to shine this light into both eyes so it may be a little bright, but I'm going to put my hand here and check both sides while I'm looking. Both constrict, so pupils are equal round, reactive to light. Now I'm going to check what's called accommodation. So what I want you to do is look at that wall in the far. Now look at my pen. Following in. Very good. Pupils accommodate. So we can say Perla. The next thing I want to do is check the eyes again for any redness, swelling, and drainage. And I didn't see any, but I'm going to shine a light. Check again, and there is none. Now I'm just going to peek at your nose. No drainage. Now if you can open wide and say ah.
Ah.
Good. Tongue is moist. Can you smile for me real big? Teeth are intact. Dentition is fine. And the next thing I'm going to do is palpate your head. Okay, and let me know if there's any tenderness anywhere.
No.
Any tenderness? Okay. Head is normocephalic, atraumatic. Now I'm going to check the lymph nodes. Occipital, postauricular, preauricular, submandibular, submental, tonsillar, anterior cervical chain, posterior cervical chain, supraclavicular. And all that is, there's no lymphadenopathy, so that's very good. Trachea is midline. There's no obvious swelling over the thyroid area. Next, I'm going to listen and check your pulses. I'm going to check one at a time, the carotid pulse. 2 plus. 2 plus. And now I'm going to listen. I'm going to have you take a deep breath for me and hold it. Breathe. Take a deep breath and hold it. And breathe. No bruise. Next thing I'm going to do is measure your AP diameter. This is 2 and this is 1. So ratio is 1 to 2. Now I'm going to listen to your lungs. I don't see any labored breathing. There's no obvious cough, congestion, or adventitious sounds. And each time I place my stethoscope, just take a deep breath and let it out. Deep breath. Deep breath. Deep breath. Good. Now I'm going to listen to your heart and just breathe normally. Aortic. Pulmonic. Tricuspid. And I'm just going to lift this up a little. And mitral. Now I'm going to go back and listen with my bell. Mitral. Tricuspid. Pulmonic. Aortic. S1 and S2 heard without murmurs, gallops. Heart rate is regular rate and rhythm. And I'm going to listen to your heart rate here for 30 seconds. Actually 15, and I'm going to multiply it by 4. Okay, heart rate is 78. I'm going to feel for the PMI, and I don't really feel it. It's less than 1 centimeter. Now I'm going to have you turn this way for me while I listen to your lungs in the back. Take a deep breath for me. Good. And again. Deep breath. And again. You doing okay?
Yeah.
Deep breath. And again. Deep breath. And again. Deep breath. And again. Good job. Now under your arm, if you can lift your arm a little, deep breath. Good. And on this side, deep breath. Okay, can you turn back around?
Yeah.
Now I'm going to let you lay down for me,
Okay.
and I'll pull this out for you. And the head of the bed is at 30 degrees. I'm going to check for JVD. I'm going to have you turn your head that way for me. And I don't see any pulsations. Now turn your head this way for me. And I'm going to come around. And I don't see any pulsations. Very good. The next thing we're going to do is check your abdomen. So I'm going to lift this up slightly and check in the right lower quadrant. Check in the right upper quadrant. The left upper quadrant. The left lower quadrant. I'm going to go back. I'm going to count for 15 seconds for purposes of taping and get the bowel sounds. 12 clicks a minute. So that is normal active. The next thing I'm going to do is just feel your abdomen, and at any point in time, if there's any tenderness, let me know.
Okay.
I'm going to start here. Any pain?
No.
How about here?
No.
Pain? Any pain?
No.
Any pain?
No.
Good. Any pain here?
No.
Very good. And I'm going to inspect for any pulsations or peristalsis or bulges. And I should have done that before I palpated, but I don't see any. Next thing I'm going to do is have you sit up for me. And I'm going to examine your upper extremities and your lower extremities, okay? First thing, I'm going to feel skin is warm and dry. I don't, and let me know if there's any tenderness to the elbows, shoulders, no joint deformities. Let me see your hands. Fingernails are clean, short, and well manicured. Cap refill is breast bilaterally. Check your pulses here. Radial pulses are 2+ and equal. Check strength. Can you squeeze my fingers as hard as you can? Squeeze hard. Good. Strength's 5/5. The next thing I'm going to do is check for clubbing. So if you could do your fingers like this for me. And there's no clubbing because there's a space there. Now I'm going to assess your lower extremities. So first thing I'm going to feel for your knees for any joint deformities and your ankles, and I don't feel any tenderness or pain.
No.
Okay. Now I'm going to have you raise these up a little, and I'm just noting they're warm, dry. Color is pale but no pallor. She's fair skinned, so that's appropriate. And I don't see any ulcerations. There's no edema. There's no erythema or rubor. Now I'm going to check pedal pulses, and I'll have to check them one at a time, and then I'll check them together. Good, 2+. 2+ and equal for the dorsalis pedis, posterior tibialis. This one's a little bit more difficult. You can relax your legs where you don't have to. +2 and equal. Cap refill to the toenails. Brisk bilaterally. Now push down on my hands. Strength is 5/5. Very good. And that concludes our exam. Thank you very much. Everything was normal. Heart, lungs sounded, lungs were clear. Heart sounded good. So everything's good.
Okay. Thank you so much.
Thank you.
Thank you.